Thank you all for being here. I'm Phil Johnston. I'm chair of the board of the Blue Cross Blue Shield Foundation of Massachusetts, and we're just so pleased to be having this event this morning to talk about Medicaid and various ways of paying for it, various ways of dealing with the implementation of the Affordable Care Act. And I would just to begin, I'd like to introduce a few people who are here. State Representative Martha Walls, who represents, I think, this particular district, actually, where we are having the event, including Beacon Hill. State Representative Denise Garlick, Inspector General Glenn Cunner, Marcia Fowler, who's the Commissioner of the Department of Mental Health, who has been ubiquitous during the last couple of weeks as we've had a number of forums. As Barney Frank would correct me and say fora. He's the only person I know who does that. Will be, and Julian Harris, who's done such a great job. He's up here on the panel. You'll hear from him in a few minutes, but Julian is director of the Medicaid program. I told him he should be commissioner because remember when we set up Medicaid as a separate agency, and Bruce Bowen, who's now our COO at Blue Cross, was the commissioner, and he had worked with me in the Dukakis administration running Medicaid, and he was a commissioner. And then Mitt Romney, remember him? He was trying to forget, well, whatever. But anyway, he changed things so that now Julian is just called director, but that'll suffice, right? Okay. All right. So I just, by way of introduction, I'm going to introduce Kate Nordahl, who's running this show for us this morning. But I just want to make a couple of points about Medicaid. I don't know about all of you, but I'm a big Medicaid person, and I think Medicaid drives not only our health care for not only low-income women and children in particular, but also for disabled people and for elderly people. And you might recall that in August at the Democratic National Convention when Bill Clinton was giving that masterful speech, and you remember when he said, when they started applauding and interrupting his speech a little bit with wild applause, and he said, no, wait a minute, listen to me. I want to clarify something, and he led with not Medicare, but Medicaid. And I was sitting next to Governor Dukakis and his wife in the hall, and I said, you know, only a governor would understand the importance of Medicaid. And as you think back to 1965 when the Medicare legislation was passed, Medicaid was an appendage to the legislation. And I do a lot of work with the community health centers around the country, and thank you, those of you who are involved. I know there are a number of people here from the community health center movement. And there's a wonderful guy named Tom Van Coverden, who is the national president of the Association of Community Health Centers, and he worked in 1965 for Martha Griffiths, Congresswoman Martha Griffiths, who was a collaborator with Ted Kennedy on all kinds of health reform legislation in the 60s and 70s. And Martha Griffiths was the chairman of what is now the Commerce and Energy Committee, which has a lot of influence over the Medicaid and Medicare program. And so when the bill came to her, from Lyndon Johnson, she was very upset because the Medicaid program was not a federal program, unlike Medicare. So Tom Van Coverden tells a story about how he was in the room when she called Lyndon Johnson. He said, now, Lyndon, you know what's going to happen to these people who are going to be on the Medicaid program down in the South? They're going to get thrown to the side of the road by those governors because they don't care about black people and they don't care about poor people. And it should be a federal program. And he said, I understand, Martha, I understand what you're saying, but I can't get the Medicare program through the Congress unless I give something to the governors. And so that's what I'm going to do. And that's how the Medicaid program became 50-50 and really controlled to a large extent at the state level. And it's very interesting to also remember that when the Medicaid program was enacted, a lot of governors, particularly in the South, said, this is socialistic. We are not going to participate in this program. We're not going to have the federal government telling us what to do about anything in health care. But they all changed their tune as soon as the federal government started writing big checks to the states. And I dare say that I would predict, at least, that we might have history repeating itself this time as we go about the process of implementing the Affordable Care Act, because Medicaid, as we fully understand, I think now, is very, very important to that whole process. Just one final point, which is that I think most people in Massachusetts would be astonished to learn that 20% of the residents of the state now are on Mass Health. And there are more people on Medicaid today in 2012 than on Medicare. So it's become this huge engine that drives not only health care to a large extent, but also drives the whole human services system. It's extraordinarily important. So thank you all for participating in this discussion this morning. I want to introduce Kate Nordahl, who's been the director of the Mass Medicaid Policy Institute for the past 2 years. Charlotte Ye, who's a member of our board, and others who were involved with our foundation will remember a few years ago when we made the decision at the foundation to really focus on this issue of Medicaid, because nobody else was doing it outside of the government. And so we felt there was a need for a neutral, objective, data gathering institute to advise not only people in the public sector, but also providers and advocates and consumers as to what is happening or what should happen in the Medicaid program. Kate Nordahl, who was Assistant Commissioner of what I still call the Rate Setting Commission. I still can't remember what the new name of that thing. Didn't we change it again just recently? Too much for me to absorb. But she's one of the best people who ever worked in state government, and she's one of the best people I've ever worked with in healthcare. So please welcome Kate Nordahl, who's going to be the moderator this morning.
Thank you, Phil. I'm thrilled to be here today to discuss this incredibly important and timely topic. As Phil indicated, Medicaid programs across the country face immense challenges, and despite caring for some of the most complex, costly, and difficult populations, state budget pressures often mean that Medicaid agencies have the fewest resources to create and implement innovative payment and delivery system reforms. And yet, as one of the largest payers in the state, Medicaid programs are also uniquely positioned to drive change throughout the entire healthcare system. As we'll hear today, a number of states across the country are leading the way and working to drive improvement in quality, delivery, and cost effectiveness of care for Medicaid members. Increasingly, states, as well as other healthcare purchasers, are working to enhance the role of providers, and in particular primary care providers, in striving for these goals. Key components of the models that states are trying are alternative payment arrangements, which are moving away from the volume-driven incentives inherent in fee-for-service payment models. They're building on medical homes and integration of primary and behavioral health care, measuring and holding providers accountable for quality, and incorporating initiatives which share in savings so providers themselves can reap some of the benefits of their efforts. As Massachusetts turns to tackle the challenge of containing healthcare costs, Mass Health is critical. Our recently enacted Healthcare Costs Law, Chapter 224, sees Mass Health as a key lever for delivery system reform. And by 2015, the vast majority of Mass Health members must be covered by alternative payment arrangements. And today you will hear a brief overview of the Mass Health's developing plans in that area. We are also incredibly lucky to have representatives from Colorado, New York, Maine, and Oregon to speak about efforts in their states to promote accountability and integration of care for their Medicaid members. Each state is different in terms of Medicaid programs, their providers, their health plans, but we can certainly learn from their experience and perspectives, and I look forward to the discussion this morning.